Hi, you're welcome. Diabetes is not a death sentence. It is a manageable condition that requires just an awareness and proactive care. Hi, is Daishan Gloria Oshona. So I know of a woman, or I knew a woman that was on the big size, obese. Suddenly she started losing weight, not that she was trying to. Instead of going for a checkup, she dismissed it as what? A spiritual attack. So along the line, her legs got swollen and she happened to go for medical checkup and she was diagnosed of what? Type 2 diabetes. But by then, there are what? Complications. So this is common among so many people where, symptoms or signs are ignored or misinterpreted or dismissed until it escalates and becomes a very serious medical issues. Diabetes with early detection and management, it can be reversed. Type 2 diabetes and pre-diabetes in particular. And type 1 can be managed properly and the person can live a long life with it. So diabetes is a metabolic condition that affects the body's ability to make use of energy from foods. It may be due to the body not being able to produce enough insulin, or the body is insensitive to insulin produced by the pancreas, thereby causing what? High blood sugar levels. Now, what is insulin? Insulin is a hormone. It's just like a key that unlocks the cell and lets sugar into the cells to be used as energy. To be used as energy. But where there's diabetes, this process is a kind of hindered because the sugar is not allowed into the cells as a result of what? The insulin not being available, or the body itself not being sensitive to the insulin produced by the pancreas. And that leaves the body with high blood sugar. And where it is not being controlled, where it is not being managed, it leads to, damages of other organs around it, like the heart, the kidney, the nerves, and also eyes too. So there are different types of diabetes, and it's not all diabetes that are caused by lifestyle. Let's look at the types. We have type 1 diabetes, type 2 diabetes, then pre-diabetes, gestational diabetes, and secondary induced diabetes. So as I said, not all diabetes are caused or is caused by lifestyle. Like type 1 diabetes, comes suddenly and occurs mainly in children, teens, as teenagers, adults under the age of 30 years, although it may happen at any age. In this case, the immune system attacks the beta cells of the pancreas, rendering it incapable of producing insulin. So people with type 1 diabetes, they live on insulin therapy for life to be able to control their blood sugar level. However, this case is very rare, very, very rare. It's just about 5 to 10% of diabetes cases. Now, the next, which is type 2 diabetes, is the one that is linked to our lifestyles and is very, very common, let's say rampant, about 90 to 95% cases of diabetes are type 2 diabetes. So it happens gradually. Type 2 diabetes happens very gradual. As I said, it's linked to lifestyle, like poor dietary habits or the high intake of energy food, saturated fats, and salt too. So it's also linked to sedentary lifestyle where the person is always sitting. If you sit like 6 hours and more a day without any form of activity, that's what we mean by sedentary lifestyle. Obesity too and overweight, stress, alcoholism, smoking, and coupled with genetics too leads to type 2 diabetes. So it's unlike type 1 diabetes. Type 2 diabetes starts gradually. Individuals that have it may not even know that they have diabetes. In most cases, they report to the hospital with what? Complications. So that's why it's necessary to go for regular checkup, especially when you have these lifestyles that I mentioned earlier. Then type 2 diabetes is a case where the pancreas produces insulin, but the body is insensitive to it. The body does not make use of it. It occurs mainly in adults from 40 years and above, although it's also seen in children these days, maybe because of childhood obesity and these limited physical activities that most children are facing this period. So we also have pre-diabetes. People with pre-diabetes, um, they have high blood sugar, but it's not high enough to be classified as what? A clinical diabetes. But however, organ damage may already be occurring. So it's very necessary that people that have this kind of, or that falls into this category of diabetes should adopt a healthy lifestyle, change their eating habits, make sure if they are obese, overweight, they make sure they lose extra or excess fat and engage in regular physical activity so as not to be, not to get to type 2 diabetes. That's why I say pre-diabetes can be reversed. It can be reversed. So if you check your blood sugar level and it's reading 100 to 120, 26 milligram per dl for a fasting blood sugar, that means you have pre-diabetes. But if it is like glucose tolerance test that you did and is reading 140 to 200 milligram, that means you have pre-diabetes. So now what is gestational diabetes? That one is in women, it's not in men. So women that are pregnant for the first time in pregnancy, your blood sugar level goes high. That means you have pre-diabetes. That's why women that are pregnant, you must check your blood sugar level anytime you go for your antenatal checkup. You must make sure, require that or request that your blood sugar level is checked, because it is as a result of hormonal imbalance, which is common with pregnancy. So once the pregnancy or once you deliver, the diabetes will just disappear. But you need to be proactive. Make sure that you adopt a healthy life. Make sure you eat healthy food. Make sure that you're not obese or overweight before pregnancy. It's necessary that women always uh, they are cautioned with their weight, because obesity and overweight before pregnancy can also expose a woman to gestational diabetes. Even a healthy eating lifestyle can also expose a woman to gestational diabetes. Alcoholism, all these things can expose a woman that is pregnant to, gestational diabetes. Although people that already have type 2 diabetes are also prone to have gestational diabetes when they become pregnant. And family history too. Family history is something that cut across all these types of diabetes. So the next diabetes is secondary induced diabetes. This one occurs as a consequence of some diseases, maybe hereditary disease, medications the person is taking, especially all these uh, anti-hypertensive drugs, the endocrine diseases, hormonal syndromes, all these can expose one to diabetes. Signs and symptoms of we have three classical symptoms of diabetes. One, urinating often. Maybe urinate up to 3-4 times before dawn. And for children or teenagers that should be able to go to the toilet and ease themselves, bedwetting is also a sign of diabetes. Excessive thirst, drinking water and not getting filled. Always eating. Even after eating right now, you want to eat again. That is a sign of what? Diabetes. The person should get himself checked up. Other signs of diabetes are like dry mouth, blurry visions, getting tired, even upon waking up from sleep. After sleeping for 8 hours, you're still tired, is a sign that there is a problem. Weight loss, even when not trying to lose weight, is also a sign. Having a wound that does not heal, you need to go to check up your blood sugar level. This tingling, pain, and numbness in the hands and also the feet is also a sign. Increase or incessant infection, always having infection. Every time you're treating infection, you need to go and check your blood sugar levels. So what are the diagnoses? How do you know that you have diabetes? Sorry, you must go for a blood work. Can have a fasting blood sugar. That one is done. Usually done first thing in the morning before breakfast. That means you don't have to eat. So a blood sugar reading of 126, above 126 is a sign that there's diabetes. Then another test you can do is oral glucose tolerance test. Oral glucose tolerance test is a 2-hour test that check your glucose level before and 2 hours after you have taken like 75 grams of carbohydrate food. Next is complications of diabetes. Since diabetes is common, some folks say it as not a serious thing, but diabetes can lead to life-threatening conditions, and the complications associated with it is categorized into acute complication and the chronic complications. So the acute complication is like hypoglycemia, whereby there is a low blood sugar below the normal range. Normal range is within 70 to 100 milligram per DS. So anything below that is hypoglycemia, and it comes with this sensation, too much profuse sweating, fainting attack, and where it is severe, can even land the person into coma. Then another complication, short-term acute complication is ketoacidosis. It's very common with people with type 1 diabetes, where there are so much acid or ketones in the body. Now, the chronic complications is heart disease, kidney disease, which we call diabetes and nephropathy. You also see diabetes retinopathy that has to do with the eye problem that comes as a result of diabetes. Then diabetes neuropathy, that one has to do with all this numbness and pin and needle sensation at the feet, on the feet, and also the finger. And also it can also lead to amputation, where maybe there is a wound, ulcer, and the person did not notice it early. It leads to, gangrene, and the foot is being amputated. So these are the complications. So you don't need to freaking out. With early detection and proactive measures taken by you. That is why we talk about self-awareness. We talk about, diabetes self-care. The health, this is your health. You don't need to leave everything to your primary physicians or your dietitians. You yourself have to be a part and parcel of the journey in your diabetes care. So if you're proactive, make sure you take your drugs when you're being told to take it. You make sure you keep to your dietary advice as counseled by your dietitian. You make sure you adopt a regular physical activity. Make sure you're active where you're stable. Then make sure that you sleep well, adequate sleep, 6 to 7 or 8 hours per day. Make sure you rest. All these measures can help you and avoid uh, alcoholism, too much alcohol, and quit smoking too if you are. All these can help in making sure your blood sugar level is handled and your health too is stable. See you next time. Do well to subscribe to my YouTube channel and put on the notification so that you know when next I come up. I come up on my channel. See you and God bless.